Hello, this is Dr. Adel at Naperville Family Dental Care. Today's video log is about a very common question that many of my patients have asked me, and I think it's a question that a lot of patients ask their dentists, and that has to do with having sensitivity after fillings or crowns are placed on their teeth. First thing that we need to understand is that each tooth is just like a human being. It has a brain and a heart. And in the center of the tooth is where that brain and the heart reside. And that's called the dental pulp. And it looks something like this when we look at the image right here. It looks like an area where the outer surface of the tooth, the enamel, is the chewing surface of the teeth, an outer surface. And underneath that is the living part of the tooth called dentin, and then the center is called the pulp. That's what's keeping the tooth alive. And usually when teeth are attacked by bacteria and a cavity is formed, that becomes almost like a heart attack number one. And in a way, most teeth tend to respond and they can bounce back from that heart attack, just like a human being most likely can survive a first heart attack. As dentists, we go in and we remove the decay. By doing that, of course, we anesthetize, numb the area so the heart and the brain don't feel anything when we are doing the procedure. But that in itself is trauma. That's almost like heart attack number two. And the placement of a filling material in itself can sometimes be a heart attack number three. So if you think about this, multiple heart attacks to a pulp or the heart and the brain of the tooth can over time cause the nerve or that pulp to respond and say, hey, I'm done. I've had too much trauma for one lifetime. That's why they can get pretty sensitive. That's one of the reasons. Actually, that's the most common reason why this happens. Other times, it has to do with the type of materials that are used. A lot of times we place fillings that are made out of silver, although that's not very common anymore, but we do still place them. Some dentists do. And it works something like this, where there's a cavity in the teeth, whether it's on the top of the teeth or it's in between the teeth. And after we anesthetize, when we remove the decay, we place a filling material. This shows a silver filling material. There's also options for tooth-colored resin filling materials. And if you look at that, that filling is closer to the heart and the brain of the tooth. And over time, that can cause conduction of, or basically feeling of the cold and hot sensations in whatever we eat and drink. Sometimes even in the winter I get that a lot, where patients are saying, my teeth are more sensitive. And that's because cold air is coming in and they're feeling that more. So changes in temperature can cause that as well. Sweet sensitivity can sometimes be caused by the type of filling materials. The third thing that can also be a cause of that is that when the fillings are placed, or these restorations or crowns are placed, patients are generally very numb, and we do our best to check the bite and make sure the bite is correctly adjusted. But sometimes patients are not able to bite correctly, and the bite is a little bit higher than normal, and so what happens is that they would have to come back, and sometimes by just adjusting the bite, that trauma that is being caused to the nerve of the tooth or the heart and the brain of the tooth is relieved. Most of the time the sensitivity goes away within several weeks, and if in very rare cases we see that sensitivity linger for more than 6 months. However, as long as it stays at a certain level and it tapers down, we're in good shape. However, if it stays the same and it's tapering up and it's getting more spontaneous, then we do need to look for other possibilities and what other reasons why this is happening. I hope this has been informative. If you have any questions, please don't hesitate to call us at 630-369-8950, or you can visit us at our website at www.napervillefamilydentalcare.com. Have a nice day.